The Senate, Grunstall and Pan Newcomb, they all got up and just were very critical of Governor Branson's Medicaid privatization plan. They said they've introduced a bill to repeal it, to go back to the way things were. They said they're going to take it up in subcommittee and committee on Monday. They're going to pass it next Thursday, and they want the House to approve that bill as well. What will be the response of the House to them repealing the Governor Branson's Medicaid privatization?
Well, I'm certainly not interested in passing any bill that faces a certain veto, so that's probably not something we'll do. I'm just really disappointed. A year ago, when this topic came up, you know, we were making sure that we had a safety net in place, access moving forward, and all along the way, we've been facing delays and really sabotaging, using people to sabotage this whole idea, simply to protect the status quo. I think we would agree that there are many things about the system that we have now that are problematic. The current system, absolutely, the current system. We don't focus on wellness. We don't focus on chronic disease, making people better, improving outcomes. Those are all things that we should be looking at. And so it's disappointing that protecting the status quo is more important than finding a better future moving forward. The other thing that we shouldn't forget is that that decision entirely blows up their budget, because they have accounted for $100 million in savings in their own budget. So I'm not sure what they plan to do, but I do know this. That kind of decision would completely take over the dollars that would be available for other things. Things like education, things that are clearly priorities in this state as well. So I'm puzzled by why we're not moving forward instead of continuing to look back and protect a status quo that, I don't know, I think you've all reported on many of the problems with DHS in the past, so we can improve the system, and we should be. Iowas deserve that.
The simple truth, the Democrats can't have it both ways. They put it into their budget, they create $55 million of savings in the budget we're currently in, they propose over $100 million in savings, and yet they're not being honest with Iowans and how they're talking about and communicating what their intentions are. That ought to be the bottom line. They're not being honest with Iowans, and they're trying to have it both ways.
Are you hearing stories from your constituents with concerns about Medicaid privatization?
I'm hearing many people with questions, and the reason we're having so many questions is because we're spending our time protecting the status quo instead of moving forward. We have had this year where we actually could have built a lot of education for individuals to help them work through that process. Any change is a challenge for all of us. So helping people move forward would have been very productive. I can tell you that I asked one of my healthcare providers that I happened to be visiting over the past weekend, so what would another delay mean to your patients? That provider told me any additional confusion only causes more problems. We need to move forward, get this going, and we can deal with the rest. We just can't keep causing additional confusion. So I think that's the correct message.